Hello everyone, I am Dodivic V. Arma, a PT intern from RTRMF, and today we'll be talking about functional training for motor function disorders. Let's get started. Functional training is a physical therapy intervention used to help patients achieve control in various different functional activities and postures. It is based on careful examination of their motor function and activity performance. The tasks targeted during early rehabilitation include basic activities of daily living, such as feeding, dressing, hygiene, and so forth, and functional mobility skills such as bed mobility, transfers, and locomotion. Later in rehabilitation, instrumental activities of daily living such as home chores and shopping, community mobility, and work activities are targeted depending on the patient's level of recovery and discharge placement. Extensive practice and appropriate feedback are essential in order to reacquire skills and enhance recovery. The involved segments are also targeted for training. For instance, training the stroke patient focuses on use of the more involved extremities during daily tasks, whereas use of the less involved extremities is minimized. In addition, tasks can also be modified to permit early practice. For example, training using partial weight bearing and motorized treadmill provides an early locomotor training for CVA or SCI patients. Tasks can also be continually modified to increase the level of difficulty, promote adaptation of skills, and promote independence. For example, sit-to-stand training begins with standing up from a raised seat. Progressively lowering the seat height during training increases the difficulty of the tasks until the patient is able to stand up from a normal seated position. On the other hand, intense task-oriented training may not be appropriate for every patient, especially for those who lack voluntary control or cognitive function, such as those with TBI in the early recovery stages. Thus, its selection should depend on the degree of recovery and severity of motor problems. Therefore, threshold abilities to perform the basic components of the task should always be identified, and careful analysis of underlying impairments with focus on goals of intervention should complement with task-oriented training. That's it. Thank you so much for watching, and see you again on my next video. Bye!